Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I am excited to welcome Dr. Dorothy Merritt, board-certified clinician in internal medicine, renowned expert in integrative health, and a pioneer and trailblazer in environmental medicine.
Dr. Dorothy Merritt, thank you so much for joining us today. I know it was last minute, so I appreciate you giving us some time.
It's a pleasure.
Words that have been used to describe you are trailblazer and pioneer. And what
That's
you do.
true.
So we'll get to that momentarily. I just would love to find out about your background and what initially inspired you to go into medicine and then ultimately transition over to integrative medicine.
Well, I'm not sure what got me into medicine, but my mom was a social worker and my dad was a salesman, so now I look at myself as selling health. So that's probably how I ended up there. I couldn't decide whether I wanted to be a PhD or a MD, and MD won out. And then I ended up in Texas because my husband had a job here already, and at Baylor College of Medicine, and trained, and then I was going to go into either a specialty or out in primary care, someplace that didn't have a lot of doctors because I like challenges. And so I ended up in a little community in Galveston County called Texas City and Dickinson. Those were the two big cities down there. And I started practicing medicine night and day, 24 hours a day, seeing all forms of pathology and loving it until about the second or third year. And then when you go out 7 days a week and go to the hospital and you're going, why are all these people still having MIs, and why are they having this cancer, and why are they having all these, bronchitis and medical, and lupus is big down there, very underdiagnosed. There hadn't been an internist there for a while. And there was all this autoimmune disease, and it was just, so why does everybody have this? Why do they have to have it at 8 o'clock at night and midnight? And how can we stop this? And so then I got involved in a couple of things. One, the oncologist in the area transferred out, and I got to see the cancer community through the medical director of hospice. And at the same time, there were a bunch of nursing home cases down there, and all the people that were taking care of them didn't want to take care of them anymore. So I ended up getting all these patients and trying to figure out what to do with end-stage disease. And then I got on the public board of health and to try and figure out the epidemiology of what was going on in this county and what could we do to change it. And so I became a public health person, even though I was doing primary care. And then I got on. It was about the time when they were doing quality things at the hospital and trying to save money and get better outcomes. So all this was my early career, and I had definitely wanted to get into prevention because after a few years of this, it was like, oh my gosh, we don't want this. And I ended up doing a series of assays for a company called SpectraCell. And they were an intracellular nutrient company, and I was like, I don't know how I'd ever use this, but they needed this stuff done in Galveston County for some norms. And so we did all that. And then I was like, well, maybe I can take some of my mystery patients who nobody can cure, and maybe I can see if it points me some direction. Well, 200 cases later, I published some stuff on it because it was just absolutely amazing. There were people who were better in a week, people who were better in a month, and most people were off half their meds. They quit coming in with bronchitis. My hospital rate went from 30 a month of admissions to 3.
Wow.
And then the phone calls started coming from managed care. And that was when it was like, we want to buy your disease management program. I'm like, what is a disease management program? And I try and tell them, well, I did this and this, and I started these 2 nutrients, and voila, and they hung up the phone. I mean, a few of them had me come and talk to them.
Because they heard the word nutrient.
Yeah, well, they were like, vitamins? Yeah, right, okay, bye. And but it was the NAC, or N-acetylcysteine, plus a super mega vitamin that had all the things in it that SpectraCell measured, and it was just some over-the-counter thing available at your local mall. And it wasn't, I didn't know any better than that. I know much better now what to do, but at the time it was very simple. Take 2 of these and 2 of these a day, and let's see what happens. And I did it across the board. My cost of care went down to about 50 to 75% of everybody else's. And so I knew I was onto something. Then I knew what a disease management program was, and I wish I had sold it to them.
Exactly, and it was $1 million.
Yeah, right. But I knew it impacted the public health of my group of patients. In my hospice patients, I put everybody on a little over-the-counter vitamin and NAC. And at the time, the average length of stay or life on a hospice patient was like 3 to 4 days. And after I started that, the same month, it went up to 10 days. And people didn't require all the stomach medicines. And then I knew I was onto something. There's something here that I don't know all the things. I started collecting data on NAC because I thought that was the main thing. And at the time, there were 200 articles. And after I had, about 10 years later, after I had obsessively collected like 4,000 articles on NAC and the glutathione thing, I finally just stopped the obsession, threw it away, and said, I know people are finally onto it, so I don't have to keep collecting this stuff and proving it. But yeah, it was very interesting. And one of those articles on NAC was an article that it flipped me over to a metals thing that was published on the ACAM, which is the chelators website, right? You know, and I didn't know anything except I had just gotten out of Baylor, and I knew chelation was fraud and abuse, and it didn't work, and you know. But then I was sitting there looking at 22 pages of bibliography and 20 pages of legal bibliography, which had happened to all these people, and I'm like, oh man, I don't know what this is, but it must be something. And then it evolved, and there wasn't any problem with NAC and vitamins, so I continued that, but then I went and got trained in chelation. And then I had a little back room that we quietly and very secretly chelated people. I mean, it was legal, but you know, I wasn't about to advertise I was doing it, but I had all these people who wanted to do it because it was very hard to find anybody in the area. They had to drive, you know.
So it was word of mouth that they were coming
Word
to?
of mouth, strictly word of mouth.
Not referrals from other physicians?
Oh, never referrals from other physicians. Even now that's hard. But anyway, so after the trials and tribulations of going through that and seeing that people pinked up after, you know, 10 treatments and they could walk across a room that they couldn't even walk on before, I'm like, oh my gosh, this is the next generation of my, you know, first it was the nutrients, then it was chelation. And so I was at my second training thing on chelation, and I met Dr. Lynn Patrick that you interviewed earlier. And she and Walter Crinian, who was the head of environmental medicine at one of the in-deep colleges for years, I met them, and Lynn and I had compared notes. I showed Lynn all these heavy metal history and physicals that I'd come up for the top 4, and she was just like, oh my God, you got to come to Walter's 6-month training. And that was the most intense post-training training that I've had. And it was 6 months of pure environmental medicine and how it applies to health and all the proof. And the proof is all there. And then you take a place like Texas City that I live, or Galveston County, which that whole Houston-Galveston complex is petrochemical, huge solvent-based, huge metal-based. Well, of course, you give them NAC and you chelate out the metals that they got from the 1950s to 1980s from living in a world where we had lead in our gas. Yeah, and then all the other metals too, smoking, you know, gives you cadmium, but lead is the elephant in the room. Well, so now that I have those 3 things that I do, and you know, the chelation, put people on the vitamins, and I still have a primary care insurance-based practice that is primarily blue collar, and so I don't have to be a special, you know, functional medicine person that only, you know, people of a higher income can afford. NAC is cheap, you know, vitamins are cheap. So it's just a matter of how motivated they are to health, and we can get most people turned around.
So what happens when you are seeing your primary care patient and they're not feeling well, and all of a sudden you realize that, oh, I think that they have some toxicity based on whether it's lead or what have you in their body. So how do you transition them over to,
Well, the way I do it is I will do some standard blood tests and autoimmune or whatever tests. I always throw in a blood lead level because it's cheap, okay? And I always have samples of a couple medical foods around that have the NAC and the methylated Bs, which 60% of the population needs. And actually I did a study and 90% of an internal medicine population needs them. And so I have the free little sample I give them, and then I ask them if they take a vitamin, and if not, I tell them to pick one up front or pick whatever they want, but the one I really want them to pick is up front. It's cheap and easy. And then I say, we'll go over your labs and we'll see how you feel when you get back. Well, that's the first here's something free, get this if you can, and I'm going to order all the standard tests. So, I don't look too weird to them at that point. And then when they come back, and then I give them information. And this conference today has been very helpful because there's a lot of things I'm going to put in my little handout that I'm going to give them because, we address the gut, but, we don't order $1,000 worth of tests on the gut, but we address the gut and get them on a probiotic. We address vitamin deficiencies. We address too much of certain things in your body, which this combination will take out. And, we just try and look standard, but do all the advanced things. And when people come back, I'd say 80% of them feel much, much better and can tell a big difference. So now they're willing to listen to the rest of what you have to say.
Now, I read a statistic, and I don't, please correct me if I'm wrong, and if you would enlighten us on what this actually means, but that 20% of those that are diagnosed with a cardiovascular disease are actually through genetics, and 80% is through the environment? It's based on toxicity?
It's called environmental cardiology now, and what we know is diesel fumes, which they call them 2.5 micron particles, but you can get 2.5 micron particles cooking food at home when it's burning off old food on your grill or on your countertop. So when you cook, always, leave the fan on. This is a new fact that I learned, but anyway. So you've got those, you've got the solvents, you go to a place like Houston, they're blowing benzene and toluene and ethyl benzene and all these, chemicals in the air. And we know that metals, they just did a 347,000 person, the latest thing from NHANES, meta-analysis of all the metal studies where there weren't duplicated patients. And there's no doubt that arsenic and lead and cadmium and copper have 1 to 2 times the amount of cardiovascular disease. We know the 2.5 micron particles have close to that. So all of them have somewhere between 1.5 and 2 times the disease. And then this is what I learned this weekend, and some of the stuff I was preparing for Walter's lecture, was that if you prenatally expose people, and then you look at and those prenates absorb, like say, cigarette smoke. Then you do allergen testing on them. They have sometimes up to 16 times the response because their immune cells or their T cells are already pre-sensitized. And so now when they run into antigen 1, 2, or 3, let's say in this case ragweed, they react 16 times more. That's why places that have more diesel, have more toluene in the air, have more, or people who, like say nail painters, people who do your nails, they're dealing with toluene all day long. They get more colds, they get more asthma, they get more everything. And so it's all pretty much proven, but it's called environmental cardiology now. And there's definitely, and what's interesting is that sometimes you can measure the thickness of the lining of your blood vessels called the endothelium. You can do a test called IMT, and you can see how thick it is. Like arsenic makes it thicker, lead makes it thicker. We know that. But some of these environmental pollutants don't. So now we're sitting there looking at an IMT going, oh, you're fine, your IMT is fine, you don't have any coronary vascular disease, and they can blow out a heart attack the next day because the solvents and things like that don't necessarily increase the IMT.
So your patients today, some might be asymptomatic, some might show some sort of symptoms. What percentage of your patients, or what percentage of the population for that matter, if you tested them, would show a toxic level of lead in their body?
Well, you got to be careful with that toxic definition.
Would show lead in their body.
Oh, almost all of them. I mean, there's very few, unless they've been treated or they're taking some of these things.
Okay.
The average lead level in the United States now is 1. If you're closer to the ground, like your kid, or you work in industry, you might be up to a 2. But that already puts you at a risk group that makes you almost double your cardiovascular.
Wow.
They even did a study on non-cardiovascular young adults, which they defined as like 18 to 39. And they looked at the amount of mood disorders they had. And this
Just
was
go to my house and do a test there.
Yeah, right. And so what they found was with levels as low as 0.7, you had 8 times more ADD, depression, anxiety, and mood disorders at a level of 0.7. And you got to realize that lead is what they call a NOEL or NOEL toxin. There's no observable environmental level that doesn't cause a problem. So
Frightening situation.
Frightening situation. But luckily, if you were born after 1980, you're in luck. If you didn't live in a lead house, or you don't work in a lead industry, you're probably going to die of something else other than lead-induced heart disease.
Well, thank you for the great news. Something else to look forward to, because I was born long before 1980. Okay, so what protocols do you use to correct deficiencies or toxicity in the body? What do you recommend?
So I
in
sit
addition
there.
to chelation therapy.
Okay, so in addition to, when I look at my adult population, I start with, let's do stuff easy, and we know all this stuff is here. So everybody takes NAC twice a day. And if they drink alcohol, when they go out and drink, and this was actually in Playboy 20 years ago, you can take
That's not
one
the data,
NAC.
that's not where you found the data, though, right? Or you?
It was one of the first 200 articles I could find. No, now we know it. But if you take an NAC for every drink you take, when you're drinking, it reverses it from going to formaldehyde and takes it, and you don't get a morning after headache, and it takes it out in your urine. So if you're going to drink, or you're exposed to nail polish, or you have a huge solvent, whatever, take NAC a lot more, and you can take up to 3 or 4 or 5. I mean, you can actually take up to 40 without hurting your liver, they've shown. So NAC is the basic, and then I use an ultra, I'll just call it an ultra nutrient that has the highest amount of antioxidants, and it also has some curcumin, ginger, milk thistle, and a couple other little things, alpha lipoic and CoQ, plus all the minerals, and it has all the activated already methylated Bs. So it has all the things I know genetically we're missing. It has the highest level antioxidants, so I won't get in trouble with toxicity of good things. And I use that in NAC, and that's my standard for everybody.
You've thrown out some of these acronyms and whatnot. What does NAC stand for?
NAC is an amino acid, N-acetylcysteine, and we've used it in medicine for 50 years by itself for bronchitis, for liver disease. If somebody overdoses on Tylenol, then they come to the ER and they stick a tube down their stomach and they pour liquid NAC. Even in cardiology, they came out with an IV NAC that they can give people before a cardiac cath to preserve their kidneys. Because if you take NAC, your kidneys don't fail when you get dye.
One dose of that would do that?
Yeah, they do that right
amazing.
before. And so I just had to load people up the day before on oral. And, but I mean, some places that was the big thing in cardiology. So NAC increases your glutathione. It helps you detox things. It helps preserve things. It is your major cellular antioxidant inside and outside the cell.
So we should just be taking that prophylactically? Right.
There's about 5% of the people who cannot do that because they have a genetic SNP, they call it, or a mutation where the NAC turns into ammonia. And when that happens, they feel like they have brain fog and they feel terrible. But you know those people because they feel good for 3 days while the glutathione's going up, and then once the glutathione gets up too high, they can't excrete it, and then they feel brain foggy and horrible. So other than that 3 to 5% of people, it is the best thing you can take in today's America.
And for those that are listening or watching that are unfamiliar with chelation therapy, can you describe what that is?
Yeah, chelation therapy is, actually during the World War I, Germany could not get their stuff for clothes dyeing because they wanted to chelate out the calcium out of clothes dye. So they developed their own chelator, and it turned out to be something we call EDTA because the word is like this long. But anyway, so what this thing is, it chelates calcium, it chelates lead, it chelates cadmium, it chelates a lot of different things. And so because it was a calcium chelator, and back in the 40s and 50s, all we knew, our knowledge of cardiology was, well, there's a lot of calcium in these old clogged up arteries, but we don't know why. and we don't know how it got there, and but we know this stuff takes calcium out, maybe it'll help. So it's one of those things that was kind of, it sounded good, and EDTA worked, but it didn't work on the mechanism that they thought. But anyway, it became highly studied, and then during a couple of trials up in Detroit of these terribly lead toxic people, they were chelated. And their angina went away, and their rheumatoid went away, and all these miracle things happened, and then people started publishing on EDTA. And so anyway, so EDTA is just a chemical. They put a little bit in an IV. They put a few vitamins in there with it, and some magnesium, and just a few little things. And they run it in over 3 hours, and that's the ACAM protocol. That's the proper protocol. In fact, that's what we used in the trial to assess chelation therapy. And they sit there for 2.5, 3 hours and get their little IV and go home.
How often?
Well, in the old days, people would do it every day. They do it every other day. People got depleted. I mean, nobody knew what to do. In the trials, I recommend once a week. And if you're older or you have bad kidneys, then every 2 weeks. But you can do it as much as every other day. It's just harder on the body to do it that way. So if I have somebody who has unstable angina, their leg's about to fall off, they've got gangrene starting or something like that, I'll do it every other day. I haven't had that in a long time though, and to have to do that. And but they did 55,000 total drips in the TACT trial, or the trial to assess chelation therapy that the NIH sponsored, and it was safe. And in fact, there was no increased problem over placebo on the majority of things. I mean, there weren't any increased deaths. In fact, there were less deaths. It was a very interesting study in that the people that dropped out were the people that were in the placebo group, not in the treatment group, because the placebo group, most of those people had had an event, and they were like, why am I coming here every month or every week and getting stuck when I'm probably not even getting the real thing because I had a heart attack or whatever, and so they would drop out, and that's very unusual for a study.
So you had referred to what you were able to surmise and identify in your local area of Texas City and Galveston in regard to your, surmising that there was some sort of lead toxicity in that area. What today would be some of the conditions associated, just general public, all over the country? What would be some of the conditions associated with possible lead?
Well, basically,
and symptoms.
Sure. So there's this old checklist of 30 symptoms that some guy back in the 70s used in some Colorado clinic. I don't even know who it was or what it was, but it's a checklist. And so when I chelate people, I have them fill this checklist off, and then after I've done 10 or 15, I have them fill it off again. So I'm always looking for a way to objectifying the symptoms. A lot of the symptoms are neurological or pain. I would say those are the ones that people check off the most, depression, things like that. But the conditions that they have are mostly vascular. And in fact, that latest study that looked at the NHANES data of all these people that had the excessive lead, what it showed was 90% of it, 95% of it is cardiovascular, vascular, ischemic, something to do with the vascular system. I mean, the first symptom is hypertension. The first condition is hypertension. And they actually showed that, when I trained, it was 99% of people who have hypertension is idiopathic, which means we don't know. Now, what they showed in 2003, and it was another NHANES study, what they showed was that starting at age 40, just normal people start turning their bones over 4 to 10 times faster than they did before, and that releases the lead that's in their bones from all those years of breathing lead in the air, which was tremendously high. And that 99% idiopathic was really due to lead. And that was the most common cause from age 40 to 62 of hypertension. It isn't some weird secondary reason that we all work up. It's lead. And so, what the most common thing you can do is stop the turnover. Make sure you have vitamin D. Make sure you take calcium. Avoid. Don't sit and scrape down your own old pre-1970s house and paint. Have somebody else do that. And
or just knock it down altogether.
yeah. Get rid of the asbestos too. But yeah.
Wow. So I'm just thinking about you taking that first course in environmental medicine. So I'm thinking about going home and literally just turning your entire home into a green zone because of everything that you learned. I mean, how could that?
Well, you know how
imagine.
when you're so overwhelmed, you just can't move. You can't. I didn't know what to eat.
Right.
I didn't know what to breathe. I didn't know what to take. I just thought we're screwed. There's nothing we can do. I mean, because there's just so much. It's so overwhelming. How can we allow this? Well, I was really proud of the EPA. I mean, it has progressed so well.
But it is so far yet to go.
Well, it was getting there. I mean, until now we've got a big stop on it. It really concerns me because we are dumping 80,000 chemicals have been dumped into our environment, and there's 2,000 or 3,000 a year. We were just getting to the point where we were making people responsible for dumping all this stuff, and I'm just afraid that it has just twisted back. It's funny how you tie lead into the EPA. Do you know the original story of how the EPA came about?
I do not.
Well, there's this guy, Claire Patterson, and he was a PhD at University of Chicago. He was from Iowa, and in a lot of the old reports, they didn't know if it was a woman or a man because it was Claire, you know. But anyway, this is a really cool guy, and so he kept working on uranium degenerates into lead, or lead degenerates into uranium. I think it's uranium degenerates into lead. Okay, and so that's how they age the Earth and the solar system and all these other things. And usually they use carbon dating. So he was using lead to try and prove that, well, and so he kept getting these numbers that were double, like the solar system was double the age that every other mechanism had set. Then he went and started taking samples and realized the water was contaminated, the pipes to his lab were contaminated. He went to mountaintops, the mountaintops were contaminated, and then he realized it was the lead from gas. And that's also at the time we had nitric oxide and sulfur, and we had, I think it was called acid rain, and all these things you never hear of anymore. Well, so because of his getting involved in all this, he developed the first clean room. And so that he replaced all the pipes. Everything was lead-free, everything was clean, the air was filtered, and so he could do his experiments. Well, anyway, so he was too annoying to people, but his group started forming the EPA and the Clean Water Act and the Clean Air Act. And that's why we got rid of 90% or 95% of all those things in the environment. And if you look at pictures of then and now, it's just a totally different environment. So they have been slow, but they've made major changes over the last 30 years, but it was due to this guy. And he died of an ethyl company kept coming after him. They kept offering UC Davis to replace his chair. You know, they'd pay anything to get rid of this guy, right? And UC Davis, in their goodness, did not. But he ended up dying of an asthma attack from pollution in California. So that's his story.
Sad ending.
Yeah, but a neat man.
Wow.
Yeah.
So let's go back to the descriptions that have been used for you.
Oh no, you've only heard the nice ones.
Okay, well, I'm sure that some of your
detractors.
Detractors might have a few other things to say, but you'll be the last one standing.
Right.
When they're dead of some sort
of
of
something.
poisoning. So why do you think, Dr. Patrick especially, and here you trained together at that in that class. Mm-hmm. So, tell me why. I mean, I've done the research, so I know, but I want you to share in your own words why they use the words Trailblazer and Pioneer. And I mean, because it's not without its struggle, it was not without its stress.
I can put 2 to 2 and get 8, I guess. Mm-hmm. I mean, or I can go from A to Z very quickly. I mean, I see a pattern, and boom, I can get to Z. And I've just always been that way. And so, and I had no fear. At one point, I never feared medical boards or other doctors or other people, because I was like, oh my God, my patients love me. I'm getting them from there to there. Right. And so I guess I'm a trailblazer. Part of it, too, is that Myers-Briggs personality type. I'm a ENTP, and they're described as the flash flood that goes down the mountain, carves the trail. Mm-hmm. Well, that's me, because I really relate to that. But it's just the personality I was born or developed, and then I just thought I had a mission to do this. I mean, I thought that was what I was supposed to do as a physician.
So for physicians out there that are crossing over to the other side, you know, from being in the traditional setting and are listening to your words of wisdom and realizing that, you know, what you have to say and everything that you've written about and people have spoken about in terms of your work, if they're, you know, teetering at the idea of coming over to practice integrative medicine, what words of wisdom, because of your, both from your personality as well as your history, what words of wisdom could you offer them? Well,
first of all, you've got to believe what's true. We're here to practice medicine and be healers, not work for Big Pharma. And I'm not against Big Pharma, but Big Pharma is pretty much against integrative medicine. Mm-hmm. So I think you need to align with a very strong integrative medicine group, like A4M, MMI. I mean, because these people have the power and clout, and they have board certification, and they have CME, and they have all these different things that give you some protection. And unlike me, who thought, well, I'm going to tell everybody in the world about these findings because they want to know, you never know what person is sitting out there in another state, like, and is a quackbuster that's going to turn you in because you wrote an article about Galveston County and, you know, lead, or something crazy, you know, that is interpreted by the state board as advertising. So keep it within your group, keep it within your patients, because your best advertising and it goes among the patients you're taking care of. And especially if you're in a primary care situation and you control the patients and you're not waiting for someone to refer to you, always be in that situation, and then figure out how to do it so that it doesn't cost your patients an arm and a leg. I mean, I'm worth a lot more than I charge, but I mean, as far as dollars and cents to their costs, but after doing this for 30 years, I wouldn't do anything else. I love what I do, and it's just not worth fighting the idiots out there. You have enough of them to fight in your own group. And so don't sit yourself, like I've probably had my head chopped off 20 times. If you don't want your head chopped off, keep it down, but that doesn't mean you can't write stuff down for patients and learn all this stuff and teach it to them. So it just depends on how comfortable you are and how scared you are about things, because all this stuff is published now. This isn't 30 years ago. These all have good published data, and we have a national trial on chelation that's getting replicated right now. So nobody's bothering me about chelation now. And so, but you know, every time I'd advertise before, they'd come after me. Somebody'd come after me, not my patients and not Galveston County, be some guy in another state that was a quackbuster. And you know, that gets costly after a while to.
Of course.
So stay as close to the edge as you can and don't advertise. It's just not worth it. There's always some idiot out there, and advertise among your patients. That's your best source.
Well, wonderful. Thank you so much, Dr. Merritt.
Thank you.
It was a pleasure to have you.